morning. You're listening to The Brief Wake Up, your mindful start to the day. I am Handel, your daily coffee companion, helping you wake up informed, thoughtful, and maybe just a little amused before the day gets old. If you're commuting, corralling kids, or just standing in line for caffeine, you're in the right place. Let's get you caught up. This morning's health topic is one many people assume belongs exclusively to history books, but it does not. Syphilis is making a comeback. Once thought to be largely under control, syphilis cases have surged over the past decade. In the United States, reported infections have more than doubled. The most concerning rise has been among women of childbearing age, and as a result, among newborns. That matters, because untreated syphilis during pregnancy can be devastating. It increases the risk of stillbirth, premature birth, low birth weight, blindness, deafness, and severe neurological damage in infants. These are outcomes modern medicine knows how to prevent, but only when infections are detected early. So why is this happening now? Part of it is behavioral. Dating apps, reduced condom use, and changing perceptions of sexual risk, especially in the era of HIV prevention medications, have altered how people approach protection. Another factor is access. Fewer routine screenings, delayed care, and gaps in public health infrastructure mean infections can go unnoticed longer. And syphilis is particularly dangerous because it's deceptive. Early symptoms can be mild or painless. A small sore that heals on its own. A rash that's easy to dismiss. Flu-like symptoms that fade. Then it goes quiet. But untreated, it doesn't disappear. It moves inward, slowly affecting the brain, nerves, eyes, and heart. Sometimes years later. Here's the critical point. Syphilis is still one of the most treatable infections in medicine. A simple blood test can diagnose it, and in most cases, a single injection of penicillin cures it completely. No advanced technology, no long hospital stays, just timely testing and follow-through. So this resurgence isn't about panic, it's about attention. Public health works best when prevention is boring, when screening is routine, conversations are honest, and people don't assume it can't happen to me. Because syphilis didn't change. Our vigilance did. And the fix isn't complicated. It's remembering that sexual health is health. The news is next. This morning, an important health policy story out of Washington. The House has passed a health care bill, but it does so without renewing the Affordable Care Act subsidies that help millions of Americans afford their health insurance. That omission matters. Those ACA subsidies, officially called premium tax credits, are what lowered monthly insurance costs for many middle-class families, older adults, and self-employed workers over the past few years. For some people, they cut premiums by hundreds of dollars a month. Without renewal, those enhanced subsidies are set to expire, and that means higher premiums, quickly, for millions who buy coverage on the individual marketplace. For some families, the increase will be enough to make insurance unaffordable, forcing tough decisions about whether to stay covered at all. Why is this significant? Because health insurance is highly price sensitive. Even modest increases cause people to drop coverage, especially younger adults, gig workers, and early retirees. When healthier people leave the insurance pool, premiums rise further for everyone else, creating a destabilizing cycle. There's also a system-wide effect. More uninsured patients mean more uncompensated care, more pressure on emergency departments, and higher costs passed back to hospitals, states, and taxpayers. This isn't just about individual households. It affects the entire healthcare ecosystem. Politically, this vote is revealing. The Affordable Care Act remains law, but its affordability depends heavily on these subsidies. Passing a healthcare bill without addressing them signals a shift away from expanding access and toward cost control without coverage guarantees. Supporters argue the subsidies are expensive and were always temporary. Critics say letting them expire is a quiet rollback, not by repeal, but by pricing people out. So this isn't a technical detail. It's a decision that will shape who can afford health insurance and who can't in the months ahead. Tech and culture is next. This morning for Tech and Culture, let's talk about the World Cup. Not the goals, not the rivalries, not the last-minute drama, but the price of entry. Ticket prices for the 2026 World Cup have stunned fans around the world. Some early round matches are already priced in the hundreds of dollars. Later games, semi-finals and finals, climb into the thousands. FIFA has defended the pricing as market-based, even introducing dynamic pricing, the same model airlines and concert platforms use, where demand itself pushes prices higher in real time. And that shift matters, culturally, because the World Cup has never just been a sporting event. It's been one of the last truly global gatherings, a place where factory workers, students, families, immigrants, and lifelong supporters sat shoulder to shoulder, where accents blended, where national pride was loud, messy, and shared. When tickets move out of reach, the stadium experience changes. It becomes more corporate, more exclusive, less representative of the world it claims to unite. Now, FIFA points out, correctly, that demand is still massive. Stadiums will almost certainly sell out. But the deeper question isn't whether seats are filled, it's who fills them. Higher prices disproportionately push out younger fans, families, and international supporters from lower-income countries. The experience shifts from a people's festival to a premium product. Less about shared identity, more about purchasing power. And when that happens, something subtle changes. The World Cup starts to feel less like a cultural inheritance and more like a luxury experience. So what happens next? Many fans will follow their teams from afar, through streams, watch parties, second screens, social media clips, and shared digital moments. Technology will try to recreate the magic of being there, even when being there isn't realistic anymore. Which raises a bigger question. Is the future of global events physical access or digital participation? And if the world's biggest game becomes something most people experience through screens, what do we lose along the way? Because this conversation isn't really about ticket prices. It's about who global moments are for, and whether the world's most universal sport is slowly becoming a spectacle for fewer people, even as it claims to belong to everyone. The lighter roast is next. This morning's lighter roast is about another quiet paradox of the holiday season. The time of year built around togetherness can also be when people feel the most alone. Because loneliness isn't just about being by yourself, it's about feeling unseen, even when you're surrounded. And the holidays amplify that feeling. December becomes one long highlight reel. Family photos, matching pajamas, group dinners, engagement announcements, and posts that make it seem like everyone else is doing the holidays right. So if your life feels complicated or incomplete, it can feel like you're the only one not quite fitting into the picture. Here's where the paradox sharpens. You can be at a holiday party, holding a drink, smiling, laughing, and still feel lonely. Because it's not the number of people around you that matters. It's whether you feel emotionally connected to anyone in the room. The holidays also collapse emotional distance. old family roles resurface: the responsible one, the peacemaker, the difficult one, and suddenly you're not acting like who you are now, but who you were expected to be years ago. That can feel isolating, even while everyone is technically together. And for some people, there's grief layered on top of all of this: an empty chair in the room, a relationship that ended, a version of life that no longer exists. So if this is common, what do you actually do when someone you care about is experiencing it? First, you don't fix it. You don't cheer it away. You don't minimize it. The most powerful thing you can say is simple. Hey, you don't seem yourself lately. I just wanted to check in. That's not advice, it's permission. Second, listen without rushing the ending. Resist the urge to jump to silver linings or solutions. Instead, reflect what you hear. That sounds heavy. That makes sense. I'm really glad you told me. Validation creates connection faster than advice ever will. Third, offer presence, not productivity. Lonely people don't need packed schedules. They need shared space, a walk, a coffee, sitting together without pressure. Even a message that says, I'm around if you want company. And finally, follow up. Loneliness isn't a one-day emotion. A second check-in days later tells someone this wasn't just politeness, it was real. Because most people who feel lonely don't need to be rescued. They need to be noticed. And in a season when everyone assumes everyone else is surrounded, noticing someone might be the most meaningful gift you give. Sometimes the strongest form of togetherness is making sure one person doesn't feel invisible. Our commemoration is next. Today, December 18th, is International Migrants Day, recognized by the United Nations. A moment to acknowledge the nearly 300 million people worldwide who cross borders in search of safety, opportunity, education, or family. Migration isn't an exception in human history. It's one of its constants. It's also Arabic Language Day, honoring a language spoken by more than 400 million people, and one that shaped mathematics, medicine, astronomy, and poetry, reminding us that language carries both knowledge and culture across generations. On this day in 1892, the Nutcracker premiered in St. Petersburg. It wasn't an immediate success, but it went on to become one of the most beloved holiday traditions in the world. And on December 18, 1966, How the Grinch Stole Christmas first aired on television, a story that still resonates with its simple truth: meaning matters more than material things. And finally, a lighter note. Today is National Answer the Telephone Like Buddy the Elf Day. So if you answer the phone with a little extra joy and a lot less seriousness today, you're officially in the holiday spirit. In closing, today we talked about how public health quietly depends on vigilance, from the return of a once-controlled infection like syphilis, to policy decisions that can price people out of basic health care without ever repealing a law. We looked at how cost, whether in insurance premiums or World Cup tickets, reshapes who gets access to experiences meant to be universal. And as the holidays approach, we were reminded that the most powerful counter to loneliness, inequality, and exclusion isn't perfection. It's noticing each other and choosing connection on purpose. This is Handel for the Brief Wake Up. Stay calm, kind, and curious. Enjoy your day, and remember to top off your cup. Until next time.